Today on Vital Signs, we're talking about a question we hear all the time. Why does strep throat keep coming back? If your child finishes antibiotics, feels better, and then suddenly spikes a fever, has swollen lymph nodes, or starts describing that classic sandpaper-sore throat all over again, yes, it really can be strep. And yes, it can happen more than once, even several times. So let's break down the most common reasons strep returns and what you can do to stop the cycle. First, not finishing antibiotics. Most kids start feeling better 12 to 24 hours after the first dose of antibiotics, but that doesn't mean the bacteria are gone. If the full course isn't completed, some of the strep bacteria can hide out, survive, and flare up again. That's why completing every dose is so important. Second, antibiotic failure. Amoxicillin is the gold standard for treating strep throat, and true resistance to it is extremely rare. But many patients can't take penicillin. If your child was prescribed a non-penicillin antibiotic, some of those alternatives can be less effective, and strep might need a second round or a different medication to clear completely. Third, strep carrier status. Some people naturally carry a group of strep bacteria in their tonsil all the time. They're not actually infected, they just always test positive. Carriers might have a sore throat from a virus, get antibiotics, feel no improvement, and then test positive again simply because the bacteria are always present. If we suspect carrier status, we can retest when the child has no symptoms to confirm it. Fourth, reinfection. Strep is extremely contagious. Your child can finish antibiotics, return to school, and pick it up again from classmates within days, or siblings may pass it back and forth. And yes, you can even reinfect yourself. Strep bacteria can live for several days on surfaces, especially toothbrushes. That's why we recommend switching to a new toothbrush between day 2 and the end of the antibiotic course. So what can you do about recurrent strep? Here are the biggest steps that actually make a difference. Finish the full course of antibiotics every single time. Replace your toothbrush partway through treatment. Clean shared surfaces, doorknobs, remotes, toys, water bottles. Practice good hygiene. No shared cups, no shared utensils. Cover coughs, wash hands often. Keep sick kids home until they've been on antibiotics for at least 12 hours. And about tonsil removal, it's not recommended nearly as often anymore. Current guidelines suggest considering tonsillectomy only if a child has 7 strep infections in 1 year, 5 per year for 2 years, or 3 per year for 3 years. Most kids don't meet those criteria, and research shows that removing tonsils usually doesn't make a big long-term difference. If you or your child are dealing with recurring strep throat, come see us at American Family Care Joplin. We'll help figure out what's causing the repeat infections and make sure you're getting the right treatment to stay healthy and avoid complications. Thanks for viewing Vital Signs. Stay well, and we'll see you next time. If you are feeling under the weather, you can walk into American Family Care Joplin 7 days a week with no appointment to get a diagnosis. We will have you feeling better and back on your feet fast. AFC Urgent Care Joplin, located off 3rd and Rangeline behind Starbucks. American Family Care, the right care, right now.